Worth, back to that midnight health care insertion into the Senate spending plan. The new rules could lay the groundwork for sweeping reforms, things like health care rationing for seniors, possible limits on medical research, and government guidelines for how your doctor can choose to treat you. Who's behind it? Why was this not debated in the full light of day? Good questions for the author of The End of Prosperity, Wall Street Journal senior economic writer Stephen Moore, back with us. Stephen, good morning to you.
Hi, Bill. Good morning.
Mike Pence is a Republican from Indiana. At the top of the hour, he said, this is something that was slid in there on Saturday night.
Right.
I didn't quite follow that. What happened?
Well, we don't exactly know what happened. This news story really has exploded on the public scene in just the last 24 hours, Bill, and we've been just inundated with complaints from people about the implications of having the government essentially dictate treatments. We don't know exactly how it got in the bill. We know that Tom Daschle, who was going to be Bill Clinton's HHS secretary, has been talking about this for many years, and all of a sudden there it was, buried in this 800-page bill.
Stephen, let me point out to our viewers, a woman by the name of Betsy Mulcahy. Do you know the name from Bloomberg
Betsy
News?
McCoy, right.
I apologize, right. Betsy McCoy. She wrote this piece, and we've all read it last night and again today.
Yep.
She says the bill's health rules will affect every single person in the United States.
Yeah,
How?
Well, it especially will affect elderly people, because one of the ways, if we move more towards a nationalized health care system, as this bill would move us one step towards that, what you have to do to restrain costs, what many other countries do, like Canada and Britain, is they essentially bill ration care, and they tell patients, you are eligible for this kind of care, but this is too expensive. And so what this bill would essentially do is set up a kind of pricing mechanism to tell people, yes, we can afford to treat you for this, but not that. So for elderly people who may want let's say a hip replacement bill, or someone who has diabetes who may want some kind of exotic kind of treatment that could work, those may be off ground, and the insurers simply won't insure for it.
You said a mouthful there.
Yeah,
more than a handful, actually.
Yeah.
Who slipped this in?
Well, again, we don't know the details. Bill, I just learned of this myself yesterday. In fact, Rush Limbaugh made a big deal out of it on his radio show, and it caused all sorts of calls into congressional offices. And now everybody's running around Capitol Hill saying, where did this come from? Nobody knows how this got inserted in the bill.
Well, the healthcare industry is the largest employer in the United States.
Well,
it produces 17% of the nation's GDP.
You're right, and it's the one industry that's growing. I heard from a lady yesterday in Arizona who told me a story about how she has diabetes, and she had tried various kind of treatments, had been to many doctors, and she finally found a doctor who literally saved her legs from being amputated. That's the kind of treatment she was saying she wouldn't have been able to shop around for health care under this kind of system. So people are pretty outraged over the idea of a kind of health care triage system.
You mentioned Tom Daschle.
Yep.
His candidacy is no longer because of the tax issue. He wrote a book about this.
That's right.
And apparently he was quoted, I guess it was 2 years ago, according to this article, if that means attaching a health care plan to the federal budget, so be it. Well, that appears to be what is happening in the Senate version.
That's right.
Now, once we go to conference on the House committee, do we have any indication as to whether or not this thing lives or dies?
Well, that's why it's important for people to express their outrage over this bill, because starting tomorrow, they're going to have this conference between the House and Senate, iron out the differences. And if there's enough outrage, I think a lot of this will be taken out. As I said, just in the last 24 hours, if people have been aware of this, there have been howls of complaint all over the country. Another example, by the way, is Oregon has a system very much like this, where you basically have a system where some types of treatments are covered by the Oregon healthcare system, others aren't, and they just have a pecking order, and if your treatment is too expensive, they won't allow insurance for it.
Wow. Yep. State of Oregon, you say?
Yes.
Just to read from Betsy McCoy's article one more time. The stimulus bill will affect every part of healthcare. From medical and nursing education to how patients are treated and how much hospitals get paid. This is enormous.
Yeah.
Stephen Moore, thank you for your time. We're on it here. We're going to talk to John Tester, a Democratic Senator from Montana, about this and more coming up top of the hour. Stephen, come on back. Okay?
See you, Bill. Take care.